Welcome to the Dental Podcast.
Thanks for having me.
You know, we live in this era where our bathroom habits are just increasingly dictated by algorithm.
Absolutely.
Like you scroll through TikTok or Instagram, and suddenly you're convinced that the way you've been brushing your teeth for 30 years is wrong,
Right.
and that the secret to a movie star smile is, well, it's dirt.
Basically dirt, yeah.
I mean, I'm talking about the charcoal toothpaste trend. It is everywhere right now. It's messy, it's highly dramatic, and it promises the world to anyone who uses it.
It's a really fascinating cultural phenomena. You have this pitch black paste, which visually represents the exact opposite of what we actually want.
Right. Clean white teeth.
Exactly.
Yeah.
And yet people are scrubbing away with it, totally convinced it's the holy grail of oral hygiene. I think it appeals to that ancient secret part of our brains.
Yeah, the whole idea that if it's natural, it just equals better. But today, we aren't just trusting the influencers. We are doing a proper deep dive into the medical reality of this trend.
And it's a very needed deep dive.
For sure. So we're working from a specific advisory report today, and it's titled, Is Charcoal Toothpaste Safe? We're analyzing it alongside the profile of the actual practice that issued the guidance.
Which is Dental and Med Spa out of Arlington Heights, Illinois.
Right. And our mission today is really a two-part investigation. First, we have to deal with the chemistry and the physics.
The mechanics of it?
Yeah, like, does charcoal actually work? And more importantly, is it safe for you to put in your mouth? We're going to get into the nitty-gritty of abrasion and enamel health.
And then secondly, we really need to look at the source itself.
Dental and Med Spa.
Right, because they represent this really interesting evolution in healthcare, the dental med spa model.
It's a hybrid.
Exactly. A hybrid model that completely changes how we think about the dentist's role in our overall aesthetic and health.
I want to start with the black powder itself, though, because when I see the word charcoal, I instantly think of a barbecue grill.
Charcoal briquettes.
Yeah. How did we get from grilling burgers to brushing our teeth? Because the source material specifies activated charcoal. Is that just marketing fluff, or is there an actual chemical difference?
No, the activated part is chemically critical. This isn't just the stuff you scrape off burnt toast or the bottom of your grill.
Okay, good to know.
To activate charcoal, it's treated with extreme heat or oxidizing gases. And this process blasts billions of microscopic holes right into the carbon structure.
Wow.
Yeah, it increases the surface area exponentially.
So it becomes really porous.
Incredibly porous. You have to think of it less like a rock and more like a rigid microscopic sponge.
Okay.
And because of this specific structure, it gains a property called adsorbency. And I really want to be clear here. That's adsorbency with a D, not absorbency with a B.
Okay, you're going to have to walk me through that distinction. I feel like I use those words completely interchangeably.
Most people do, honestly. Absorption with the B is like a sponge soaking up water. The water goes inside the volume of the sponge. Adsorption with a D is strictly a surface phenomenon, like Velcro or a magnet. Molecules bind to the actual surface of the charcoal.
So it acts like a sticky trap.
Exactly. When you brush with activated charcoal, those particles act like little magnets for tannins, proteins, and surface debris. They bind tightly to the charcoal.
So when you spit the black gunk out...
You are theoretically dragging those surface stains out with it.
Which totally explains the appeal. The report actually mentions that users often see what they call a temporary brightening effect.
Right.
And I get it. If you scrub the grime off a window, the room looks brighter. It's immediate gratification.
It is very immediate, and that is the hook that gets people. But here is the massive misconception that we need to clear up, and the Dental report is very, very specific about this.
Okay.
There is a fundamental difference between stain removal and actual whitening.
Wait, isn't removing the stain the exact same thing as whitening the tooth?
Not medically, no. Stain removal is entirely mechanical. It's essentially polishing the surface. You're just removing the coffee, the wine, the tobacco that sits on top of the enamel.
Oh, I see.
But true whitening is a chemical process. It involves penetrating the enamel to change the intrinsic color of the tooth structure itself.
So if my teeth are naturally a bit yellow-like, maybe that's just my genetics, charcoal isn't going to touch that.
It won't do a single thing for that. Charcoal is strictly a surface-level operator. It cannot change the natural shade of your dentin or your enamel.
Got it.
For that, you really need chemical agents, usually peroxides, that oxidize the internal pigments. Charcoal is basically just a very aggressive window cleaner. It doesn't change the color of the glass.
Aggressive window cleaner.
Yeah.
That actually brings us right to the core safety question. The advisory we're looking at is literally titled, Is charcoal toothpaste safe?
Yes.
If it's just scrubbing off stains, what's the actual harm? Why do we need a warning label?
The harm lies completely in the physics of the scrub. This brings us to a concept called the sandpaper effect.
That doesn't sound great.
No, it's not. In dentistry, there's a scale called the RDA relative dentin abrasivity. It measures how scratchy a toothpaste is.
Kind of like grit levels on sandpaper at the hardware store.
That is the perfect analogy. Standard toothpaste is formulated to be low on that scale, safe for twice daily use. Charcoal, just by its very nature, is a jagged, abrasive particulate.
So when you brush with it,
You aren't just wiping the tooth, you are actively sanding it.
but enamel is the hardest substance in the human body, right? I remember learning that back in school. Can a little powder really hurt it that much?
It is the hardest substance, yes, but it is also brittle, and most importantly, it is completely finite. It does not grow back.
Ever.
Never. You cannot regenerate enamel. Once you scratch it away, it is gone forever.
Mm.
And the report warns that the highly abrasive nature of charcoal can slowly just wear down that protective layer.
So you're thinning out your primary defenses.
Correct. And this leads to a really cruel irony that I think is the most important takeaway from the entire Omnidental report.
Let's hear it.
Enamel, the outer layer, is white and translucent. Underneath the enamel is a layer called dentin. Do you happen to know what color dentin is?
I'm guessing it's not white.
It's yellow,
Yeah.
naturally yellow. So follow the logic here. You use charcoal to whiten your teeth. The charcoal abrades the white enamel, making it much thinner.
And as the white layer thins...
The yellow dentin underneath starts to show through more clearly.
Oh, wow. So by scrubbing too hard to get white teeth, you eventually make them look yellower.
Precisely. You are accelerating the visual aging of your teeth. You're achieving the exact opposite of your actual goal.
That is a backfire of epic proportions. And presumably, once you thin that enamel out, you're opening the door to a bunch of other problems, too.
A whole cascade of problems.
Mm.
The report lists increased sensitivity as a major risk.
Because the shield is gone.
Right. As the enamel thins, you lose thermal insulation. Suddenly, a glass of cold water or hot coffee sends a zinger of pain right to the nerve.
The ice cream hurts phase.
Exactly. And even worse, the source warns of an increased risk of actual decay. Think about a polished marble floor versus a rough concrete sidewalk. Which one is easier to sweep clean?
Definitely the polished floor. The rough one is going to trap dirt everywhere.
Exactly. When you scratch your enamel with charcoal, you create a rough surface texture. That roughness becomes a microscopic hideout for plaque and bacteria.
So you're trapping the bad stuff.
You are literally creating footholds for cavities to form.
That makes so much sense structurally. Now, the source also mentions the everyday myth. I assume most people just buy a tube of this charcoal stuff and swap it out for their regular Colgate, right? They use it morning and night.
And that is the absolute most dangerous behavior. Omnidental is explicit here. This is not a daily toothpaste.
The cumulative damage.
Yes, the cumulative abrasion of scrubbing twice a day is where the really permanent damage happens.
There's another factor I noticed in the report, too, the fluoride issue.
Yes, the fluoride factor. Because charcoal is heavily marketed as natural and holistic, it almost always excludes fluoride from its ingredients.
And fluoride is important.
Fluoride is the mineral that remineralizes enamel and fights decay. It's the primary chemical defense mechanism we have.
So if you switch exclusively to a charcoal paste, you're sanding down the walls and you're firing the security guards at the same time.
That's a perfect analogy. You are actively abrading the tooth while simultaneously depriving it of the very mineral it needs to repair microscopic damage. It's a double whammy for your dental health.
Okay, so let's be practical for a minute. If you're listening to this and maybe you have a tube of this black paste sitting on your bathroom counter right now, should you just throw it in the trash?
Right.
Or does the report offer some kind of middle ground?
They do offer alternatives. Omnidental suggests that if your main goal is stain removal, you should look for ingredients that are effective but much less abrasive.
Like what?
They list baking soda, which is a classic for a reason. It's very low on the RDA scale, but it's highly effective at neutralizing oral acids and lifting those surface stains.
What about the chemical options you mentioned earlier?
They mention hydrogen peroxide. That is the gold standard for actual whitening because it works chemically, not aggressively. And silica is another common polishing agent that is generally considered safe.
But let's say someone is stubborn. They just love the way the black paste looks on their Instagram feed. If they insist on using it, what are the rules of engagement?
The safety protocol. Omnidental lays it out very clearly. First is frequency. Do not use it daily.
How often then?
Use it occasionally, maybe once a week or once every 2 weeks. You have to treat it like a specialized face mask, not your daily soap.
Okay, occasional use only. Got it.
Second is technique. Do not scrub. This is crucial. Apply it very gently. Let the adsorbency, that chemical magnetism we talked about earlier, do the work. You don't need muscle. You need contact time.
So really low pressure.
Practically zero pressure. Third rule, do not swallow it. It's an absorbent, remember. You don't want it absorbing essential nutrients or daily medications in your digestive tract.
Oh, that's a great point.
And finally, and this is definitely the most important one, consult a dentist first.
Which perfectly brings us to the source of all this info. Because it's easy to find advice on a random blog, but this is coming from a very specific clinical environment.
Yes, it is.
We are analyzing the profile of Omni Dental and Med Spa in Arlington Heights, and I think the context of who is saying this really matters here.
It matters immensely. When you look at the bio of the lead dentist, Dr. Bylas Poles, you see something very interesting. He has over 10 years of experience, but his bio specifically highlights his background in treating dental injuries and emergencies.
Severe trauma care.
Exactly. This is a guy who repairs broken teeth, knocked out teeth, massively fractured enamel. He deals with the absolute worst case scenarios.
Yeah.
So when a dentist with a heavy trauma background tells you that a commercial product is too abrasive, he's speaking from the perspective of someone who literally has to rebuild destroyed teeth.
He knows exactly what the damage looks like up close. That definitely adds serious weight to the warning. But the thing that really fascinated me about this practice is the name itself, Omni Dental and Med Spa.
Yes.
Because usually the dentist is the very last place I associate with a spa experience. For me, it's usually fluorescent lights, that weird drill sound, and a lot of anxiety. But this seems to be a completely different model entirely.
It is, and it's a rapidly growing trend in modern healthcare right now. The dental med spa.
Yeah.
It makes perfect anatomical sense if you really think about it.
How so?
Who knows the structure of the face, the bone, the underlying muscle, the intricate nerves better than a dentist? They spend their entire academic and professional career focused entirely on the physiology of the head and neck.
That's true. They are absolute masters of injections in that highly specific area.
Exactly. So OmniDental has basically expanded their scope to treat the whole face. The source details a really surprising range of services. We're talking about Botox, dermal fillers, Sculptra, platelet-rich fibrin.
So you can literally go in for a routine teeth cleaning and leave with Botox.
Theoretically, yes. And notice how these things overlap clinically. Dentists use Botox not just for wrinkles, but to treat severe TMJ pain or to correct a gummy smile where the lip pulls up too high. It's highly functional and aesthetic.
I see they also list skin treatments on here. Microneedling, laser pigmentation removal, hydrofacials. They even have permanent makeup like microblading and lip blushing.
And body sculpting and laser hair removal. It is a fully comprehensive aesthetic center housed directly within a dental practice.
Now, I have to play devil's advocate here for a second.
Oh, for it.
Does this dilute the actual dentistry? Like, if my dentist is super focused on laser hair removal or lip blushing, are they really paying attention to my complicated root canal?
That's a very valid skepticism. But looking at their service list, the dental side is incredibly robust.
Yes.
This isn't a fluff practice at all. They cover the full spectrum of serious, heavy-duty dentistry.
What stood out to you on the clinical side of things?
Well, they do all the general dentistry deep cleaning, root canals, but they also offer sleep apnea appliances. That's a very serious airway health issue. And on the reconstructive side, they list all-on-4 and full arch dental implants.
All on 4, that's replacing a whole set of teeth at once, right?
Yes. That is highly complex surgical work. It requires intense precision and deep, deep expertise in human bone structure. The fact that they offer full arch implants confirms that Dr. Poles and his team are clinical heavy hitters.
So they can do the major work.
They aren't just doing the pretty stuff. They are doing the fundamental structural engineering of the mouth.
And they also list emergency dentist as a key service, which ties right back to Dr. Poles' trauma background you mentioned earlier.
Which is absolutely vital for a community. If you wake up at 2 in the morning with an abscess, or you crack a molar on a popcorn kernel, you need a place that can handle acute pain and trauma. OmniDental firmly positions itself as that regional hub.
It's interesting how this all connects back to the charcoal advice we started with. You have a practice that is clearly heavily invested in aesthetics. They do smile makeovers, veneers, Invisalign, Botox. They clearly want you to look good.
Right, that's a big part of their business.
So when they tell you, hey, don't use this viral whitening trend, it just carries a totally different kind of weight. They aren't anti-beauty.
Exactly. They are fundamentally in the business of beauty. But because they are medical professionals first, they prioritize long-term biological integrity.
Makes sense.
They're essentially saying to their patients, we want you to have a beautiful white smile, but not at the cost of destroying your functional enamel. They advocate for safe, professional whitening, rather than a DIY internet hack that damages the foundation of your teeth.
It's basically the difference between carefully painting a house and just burning it down to clear out the spider webs.
That is a very dramatic, but entirely accurate metaphor.
So let's ground this for everyone listening. We've been talking a lot about this practice in Arlington Heights. If you're listening and thinking, okay, I really need to get this charcoal damage checked out by a pro, or maybe you just want to book a hydrofacial, where exactly are they located?
Omni Dental is physically located at 305 East Rand Road in Arlington Heights, Illinois.
So this is really serving those northwest suburbs of Chicago.
Correct. And the source document lists a pretty wide service net for them. They explicitly mention serving Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, Des Plaines, and Elk Grove Village.
They cover a lot of ground.
They are definitely positioning themselves as a major regional hub for both dental and aesthetic needs.
And if someone wants to book an appointment with them?
The contact number listed in the source is 847-483-8833. Or, like any modern practice today, you can easily just book a consultation online. And honestly, if you've been scrubbing away with black charcoal powder for the last 6 months, booking a consultation to check your enamel thickness is probably the smartest move you can make today.
Absolutely. It is always better to know where you stand now than waiting until the tooth literally starts crumbling over dinner.
Completely agreed. Proactive care is always better than reactive trauma care.
So let's pull this all together as we wrap up. We started with this massive, viral, trend black toothpaste, and we ended up analyzing the evolution of the entire modern dental office model. What do you think is the big synthesis here?
I think the biggest takeaway is that biological reality is always going to win over a social media trend. Charcoal is just a tool with a very specific mechanism, abrasion and adsorption.
It's science, not magic.
Exactly. It is not magic. If you misuse it, you are actively trading your long-term health for a very short-term visual fix. You are literally thinning your permanent enamel just to remove a surface coffee stain. Medically speaking, that is a terrible trade.
And regarding the Omni Dental model itself,
It represents a really refreshing shift in patient care. It's the realization that health and beauty are not separate silos anymore. Your dentist can be the person who flawlessly fixes your cavity, and also the person who helps you with your skincare or your overall self-confidence.
it's all connected.
It's a much more integrated, holistic approach to how we present ourselves to the world and how we feel about ourselves.
I really love that. It's all about confident but safe, sustainable confidence.
Precisely.
So here's a final thought for you to mull over gently, please. We live in this era of natural obsession right now. We constantly assume that if something comes straight from the earth, like charcoal, it must inherently be safer than the chemicals cooked up in a lab. But let's just remember for a second. Arsenic is natural. Poison ivy is perfectly natural. Abrasive rock dust is natural. Just because it comes from the ground doesn't automatically mean it belongs inside your mouth twice a day. Maybe the most natural smile you can possibly have isn't the one that's been aggressively scrubbed with charcoal. Maybe it's the one that actually still has all of its original enamel intact 20 years from now.
That is a phenomenal point to end on.
Just something to think about the next time you're endlessly scrolling through TikTok while standing in the toothpaste aisle. That is going to do it for this deep dive into Omni Dental and the charcoal craze. Thanks so much for listening.